Yeah. So, along these lines, others have realized that people are very interested in the oral formulations. And we've had a lot of compounding pharmacies, right, in the past. And that has been cut down because there's no longer a shortage of these medications. But recently, there's been some interesting news that Hims and Hers has put out their own version of oral Wegovy. And this has led, not surprisingly, to Novo Nordisk really being upset and suing over this because the oral formulation has a special absorption enhancer called SNAC. That's the abbreviation. And you can't just copycat it and sell it. They're selling it for a lower price. So the oral Wegovy starts at $149, which is a great price, but they're offering it for $49. So what do you think people are going to choose? So it's very, very concerning because there's not regulation over the compounded versions. And also there's a lot of concern of, well, what are they using? Are they using SNAC, which has been patented by Novo Nordisk? Or are they using something else that has never been studied, like not regulated, that could potentially be a huge safety concern?
Right. And if you're using something that hasn't been investigated, what is that? Is it going to work? Is it not going to work? If someone takes too much, could it hurt their body? We have no idea. So this is going to be interesting. I mean, I think within 24 hours of announcing that they were going to have an oral semaglutide, Novo Nordisk went in and snapped really quickly, as they should, right? You can't sell something and compound it and say it's going to work if this has been an ongoing thing when we had all the GLP-1 shortages. I have not had anyone have a shortage, by the way, in any injectable or oral or the oral semaglutide in I can't tell you how long. Like, it's just this distant, awful memory, right? Of injectable, all of them we had shortages on. It was like, well, take this, switch to that. It was just like this nightmare. It's gone, okay? They are making plenty of it. I've had no one say to me, I can't get whatever, 10 milligrams of tirzepatide or 2 of semaglutide. None of that is happening. So to have a company compound and say we're selling this I mean, it's bold, but it'll be interesting to see what happens.
Yeah, I mean, I think it's not.
And you have no idea what it is, right? How do you recommend?
Yeah,
Right?
it's
That's
it's
the yeah.
very, very concerning because this is a very difficult drug to get absorbed orally. And so it requires very specific technical technology. And yeah, we just don't know what they're doing. And that's like putting out a drug that's just never been tested. I mean, these drugs need all these like phase 1, phase 2, phase 3, phase 4 clinical trials, like years of research and money being poured into it to get a drug approved. To just put something out there is very, very concerning. We all want cheaper drugs. So I get it. Like I get, that we of course we all want lower price drugs, but we need to do it in a safe way. And I think we've seen impressive changes in the costs. I mean, we went from like $1,300 per month GLP-1s to now starting at $149. Yes, it goes up from there, but I think the highest price now is $499, which is still high, but that's better than $1,300 a month. So it's getting better, and we need to do it in a safe way. So it'll be kind of interesting. And I just would encourage listeners, viewers, to just be wary of compounded oral formulations in general, because I see a lot of this being advertised, and I doubt a lot of these are even being absorbed at all. So even though, yeah, you're getting a discount, $49 a month, it may just be a placebo that you're taking. And at worst, it could be actually dangerous. It could have major safety issues. So I would just steer clear of those.